Hi, I'm Dr. Mark Bratby, Medical Director at VeinCentre. In this short video, we're going to answer the questions, are varicose veins dangerous? For most patients, varicose veins aren't dangerous, and many patients live with them for many years. Sometimes they don't cause any symptoms, and the only issue is they are unsightly, and sometimes patients will come to see us at that stage. However, a lot of patients often progress on to getting symptoms which can range from relatively mild to quite severe, and on the severe end this can be significant heaviness, throbbing, and then also things like itching, cramps. There are, however, certain medical complications that can occur with varicose veins in the longer term. These include things such as thrombophlebitis, bleeding from varicose veins, severe venous eczema, skin breakdown and skin ulceration. A lot of patients ask me, am I at risk of getting a deep vein thrombosis with varicose veins? The answer to that is, for most patients, no. Millions of people do have varicose veins, and if this was a high risk, then we would be offering treatment more for everybody at an early stage. However, if you have varicose veins, particularly large varicose veins, then there's more of a higher chance of you getting a condition called thrombophlebitis. This is when you get a clot within the superficial veins. This generally isn't a dangerous clot, but it can cause a lot of local pain and inflammation and does take some time to settle down. Superficial thrombophlebitis is associated with a small risk of deep vein thrombosis, and if you have phlebitis, VeinCentre would always recommend you have an assessment and discussion around treatment options, as phlebitis is likely to recur and is certainly a good stage time to think about coming for treatment. Other issue, varicose veins can cause something called venous eczema. This is where you get pressure on the skin, particularly around the feet and ankles, with pigmentation and discoloration of the skin. This means that the skin quality is reduced and you're then at more risk of any breaks to the skin not healing, and also there can be a lot severe itching requiring local treatment, including steroid creams. Generally, this doesn't get better by itself and is another good reason to come forward and have treatment at that stage. Varicose veins in the longer term can lead to skin damage, and this skin damage can impair the ability of the skin, particularly around the feet and ankle area, to heal properly. This can then lead to a venous leg ulcer, which is the commonest cause of ulcers in the United Kingdom. Although treatment of these is often with compression, bandaging and stockings, the key to increasing the healing of those ulcers and preventing them recurring is to treat the underlying cause, which is the venous reflux and varicose veins that are contributing to the poor skin quality. If you're at all worried about varicose veins, it's important that you seek an opinion from a vein specialist who will be able to go through all your concerns following an examination and a detailed scan.